Madam President, I come to the floor today as a senator as well as a physician, and I want to do this to reassure the American people that we are doing everything possible to combat and contain the coronavirus. Madam President, according to Johns Hopkins University, well-known medical institution, we here in the United States are the most prepared nation on the face of the earth to protect ourselves, and in terms of preparation for something, an infectious disease like the coronavirus. Nevertheless, this virus is a global concern and is a pandemic potential and problem. The outbreak, we know, started in China. Goes without saying, we are deeply saddened by the loss of life there as well as here and around the world. And we're concerned about those currently suffering from the virus. But, Madam President, our focus continues to be on protecting the health and the well-being and the safety of the American people. That's where we need to focus. Notably, President Trump's early travel restrictions on China have actually helped slow the spread of the virus. He has since expanded these restrictions. The President, I believe, has acted swiftly, boldly, decisively to contain the virus and to keep Americans safe. Still, this country is not a hermetically sealed bubble, never will be, can't be, so we're likely to see more cases here in the days and the weeks ahead. So we all must be prepared and we must stay vigilant. Be assured, the Trump administration is fully engaged in responding to this virus. The United States has the best public health system in the world, and we have a plan in place to combat the coronavirus. Our public health experts are working to identify and to isolate the virus, as well as to produce a vaccine. And the fastest you can ever produce a vaccine is usually several years. We seem to be moving faster than that with regard to coronavirus. But vaccine development, even though moving faster than ever, will still take at a minimum of a year to a year and 6 months to have a vaccine available and produced at a level that could actually impact the population of the country. It's because it's a new virus, so a new vaccine needs to be developed. Now, the Vice President said over the weekend that we expect to have a vaccine available sometime next year, and I agree. And meanwhile, our strategy for testing, for isolation, and for quarantines right now is helping to lower the risks. Years ago, we created an infectious disease rapid response team. The goal would be there to make sure we were ready if the time would come, and the time has now come. Test kits are becoming more widely available for states and communities. We heard it today over the noon hour that they're expecting to have enough test kits available around the country to, over the next week, test 1 million people. And we're going to continue to use every available tool we can in this fight. The White House has created a coronavirus task force led by Vice President Pence. The effort's headed by top officials at the Center for Disease Control, the National Institutes of Health. Had a chance to visit with a number of them today, and specifically the infectious disease group through the NIH. We've had a number of briefings through the Centers for Disease Control, recently by Dr. Ann Suchat, who is the head of the Center for Disease Control in the area, helping with our efforts on coronavirus. As she has said, our aggressive containment strategy here in the United States has been working, she said, and is responsible for the low level of cases that we've had so far. Officials at the CDC and the National Institute of Health are coordinating with other federal officials, and they tend to be working around the clock. The administration is making sure that state and local officials have all of the resources they need to respond. Dr. Suchat has said that our healthcare system, our businesses, our communities, and our schools all have action plans. Senators have had a number of briefings from officials at both the Centers for Disease Control and the National Institute of Health. They are working on ways to identify the virus, to test for the virus, ways to treat people who are infected by the virus. They're working on quarantines and on a vaccine. That's what they should be doing. This is a massive nationwide undertaking. Now, at every meeting, and I have been going to meetings on this since it was first noted around the beginning of the year in this issue in China, whereas I think people now know that the doctor who tried to get the word out to the world, who was the first to notice this specific new virus, the coronavirus, he was reprimanded by the Chinese for trying to do just what he learned to do as a doctor, which was to share medical knowledge and information to try to get ahead of a disease that is progressing. He was reprimanded by the Chinese government, and he has subsequently died of the disease. But there are a number of us, and it was bipartisan, would go as senators to briefings going back. We've been going to briefings since the time of the impeachment. We would have impeachment in the afternoon and discussions about coronavirus in the morning. So there has been a focus on this for probably longer than most members around the country had been focused on it. And at every meeting, we'd ask the members from the Center for Disease Control and the National Institute of Health, do you right now have the funds you need for the things you need to do right now? And at all of those meetings, they said, yes, we have what we need. Well, now things have changed. Now they say they need additional funds, and they are right, and we agree. We need funds for more testing, for more treatment, for more vaccine development. It's appropriate that Congress appropriate that money. And I believe Congress must act quickly and decisively to protect the public by passing a bipartisan emergency funding bill. Both parties agree this effort has to be fully funded. We know that the initial numbers that were being discussed were only a starting point. We don't know what the total number is going to mean, but the team is going to continue to have all of the funds that they need to deal with this disease. So I find it very disturbing, Madam President, to see Democrats, especially those running for president, politicizing the issue. Headline yesterday's New York Times, Democrats hit Trump on virus. They're talking about the presidential candidates running for president, attacking President Trump on the virus. Madam President, the coronavirus is a deadly disease. It's not a political tool to try to tar and feather President Trump. We need to be working on this together. This should not be about Democrat candidates trying to defeat President Trump, but about defeating the coronavirus. That's what we ought to be focusing on, Madam President. And Madam President, as a doctor, my focus is on the health of the American people. So my advice for those who may be watching is this. It's the same common sense advice you'd take if you were saying, I want to avoid getting the flu during flu season, and it is flu season as well. Cover your mouth when you cough. Wash your hands frequently. If you're sick, stay home. Those are the kind of common sense things people can do at home, not just to prevent the flu, but also to protect themselves against the coronavirus. There is no reason for lots of anxiety or for panic. As a nation, we're in the right position to deal with the challenge that we face, and this administration will continue to do everything in its power to keep America and Americans safe. But now it's time for Congress to do its part, to pass the emergency legislation and get it to the President's desk. Thankfully, we are the most prepared nation to face this challenge. We have harnessed all the American energy and ingenuity and expertise that we need for this fight. The key is for all of us to remain engaged and to remain vigilant. And as a doctor, I am confident, Madam President, that we will be able to succeed together. Thank you, Madam President. I yield the floor. Suggest the absence of a quorum.